yields, the chair recognizes the gentleman from New York, Mr. Tonko, for his 5 minutes of questioning.
Thank you, Mr. Chair, and congratulations on your appointment. Look forward to working with you. And I thank you and Congressman Clark for hosting this hearing. The families of patients have to make agonizing decisions about the care of their loved ones under great stress. This is especially true when their loved one is on life support and may be nearing death. It is essential that the communication with families by hospital staff and OPOs about the patient's condition is indeed accurate and delivered appropriately so families can make well-informed decisions that respect the wishes of their loved one. HRSA's investigation identified a troubling record of the Kentucky OPO's communication with patient families. In one case, the OPO employees seeking consent to begin preparation for organ donation spoke with the patient's brother who had a cognitive impairment. This individual was described as, and I quote, childlike in case records. In a separate case, the OPO spoke with two family members who were, quote, clearly inebriated. So, Dr. Lynch, in your review, did you determine why the OPO would approach family members like those in these examples who are not in a position to make serious decisions like consent for organ donation?
The records that we reviewed don't describe the motives of the individuals that did this, but the inability to reconsider the options and to consider the humanity and the autonomy of these patients and their families is troubling.
And were OPO employees responsible for seeking consent from families for organ donation trained to interact with families this way?
That would be one of the core functions expected of the OPO.
And what do you think needs to change so this doesn't keep happening?
So we have a corrective action plan in place that includes the requirement that the OPO perform up-to-date education and setting expectations with the family, with the healthcare team, and in making sure that if at any point either the healthcare team or the family has a concern, that there is a pause in the process to allow for adjudication of that.
Thank you. And this seems like a manipulative and overly aggressive strategy. The sister of the Kentucky patient has said that she was never told that her brother had started to wake up after she had given consent for donation. She says she only found out years later. So, Doctor, the corrective action plan from HRSA directs the OPTN to develop system-wide policies for improving communication with families and empowering them, along with medical teams and other involved stakeholders, to request a pause in response to a patient's changing condition. What are the gaps in patient-family communication that you found in your investigation?
So this is, as you pointed out, one of the most horrible and challenging times in a family's life. The events that lead to somebody becoming a potential organ donor are usually sudden and tragic. Interacting with a grieving family, helping them to make educated decisions, providing compassionate and fair information, and a complete sense of what the procurement process will look like. Those are skills. They are skills that some OPOs clearly perform better than others, but they are skills for which the OPO is responsible.
Thank you. And why did HRSA conclude that the creation of a system-wide policy that includes a clear role for patient families was necessary? And what do you hope will change after that policy is in place?
One of the things that we have done with the new and unconflicted board that came in was to help them understand that the greater system of patients than we normally hear from. And the new board on its first meeting heard from a family member who was a nurse of 25 years experience. Her sister was a kidney transplant recipient, but her nephew unfortunately had suffered poor care from a different OPO, not from the OPO that we're here today discussing. Making sure that we make clear to the OPTN, to its members, that this is something that matters, that to paraphrase a 100-year-old sentiment, the key to the care of the patient is caring for the patient. Those are the key elements here.
Thank you. And how will HRSA evaluate the effectiveness of the OPTN board's policy proposals and oversee compliance of the policies when they are established?
As we move forward with this, we have several ongoing innovative areas of improving patient safety. We're making sure that there is appropriate patient and family representation on these deliberative groups, on these committees within the OPTN, so that those perspectives can be honored. That's one of the key parts.
Well, again, thank you. And the committee looks forward to receiving updates as the OPTN board and HRSA collaborate on clarifying this policy that will affirm the communication throughout the process leading up to planned organ donation that patient families are entitled to. So it's obviously needed, and your efforts are a step in the right direction. And for that, I thank you. And Mr. Chair, I yield back.